Over the last 7 weeks, I've broken down peptides for you, what they are, how healing peptides like BPC157 and TB500 can support your tissue repair, what GLP-1s are actually doing to your muscle, why your mitochondria might be the reason you're exhausted, how growth hormone peptides like CJC1295 and ipamorelin work to support your body's own recovery, and last week, how all of these peptides are actually combined and stacked in clinical practice. And the number one question I've gotten in the comments every single week is this: am I a candidate? Today I'm going to answer that. Not a generic yes or no, but with the framework I actually use in my practice to determine who benefits from peptide therapy and who doesn't. And more importantly, who should never start peptides without addressing something else first. I'm Dr. Myra Reed, a functional and internal medicine specialist with over 35 years of experience. I practice early detection longevity medicine. I help people find what others miss before symptoms become disease. Everything I do runs through my 4 pillars: hormones, gut, lifestyle, environment. I'm helping you to live smarter, stronger, longer. Here's the thing. Most people ask the wrong question about peptides. They ask, should I take BPC157? Or will ipamorelin help me lose weight? Or what's the best peptide for energy? And I understand why. You watched a video, you recognized your symptoms, you want a solution, but the right question isn't which peptide I should take. The right question is, what is my body actually telling me and what does it need? Because a peptide without context is just a shot in the dark. And I don't practice medicine that way. In my practice, I never just start with a peptide. I start with the full picture, and that full picture runs through 4 pillars: hormones, gut, lifestyle, and environment. Until I understand what's really happening across all 4 of those, I can't tell you whether a peptide is the right tool or whether something else needs to be addressed first. So let me walk you through what I actually look at before I ever consider a peptide for a patient. Pillar 1, hormones, such testosterone, estrogen, progesterone, DHEA, thyroid, cortisol, insulin. I don't look just at the total levels. I look at the free levels, the ratios, how they're working together, because a testosterone number without context is just a number. I need to see the full hormonal picture along with what's going on with the patient. Pillar 2 is the gut health. This is something most people, prescribers, they really never look at. But if your gut is inflamed, if you have leaky gut, if your microbiome is all disrupted, your body's in a state of chronic immune activation. And adding a growth-promoting peptide to an inflamed system is like putting premium gas in a car with a cracked engine block. In other words, the fuel isn't the problem. And pillar 3, lifestyle. I evaluate sleep, your protein intake. What's your diet choices? Are you doing resistance training? What's your stress management look like? How are you moving? I cannot tell you how many patients come to me wanting peptides when the real issue is they're sleeping only 5 hours a night, eating maybe 40 grams of protein a day, and haven't lifted any weights in years. Peptides won't override these gaps. They're designed to enhance a system that's already functioning, not replace the basics. Number 4 pillar is environment. Toxin exposure, water damage building mold, heavy metals, endocrine disruptors. If your body's dealing with a toxic burden, that needs to be addressed first. Otherwise, you're trying to build an unstable foundation that's actually being undermined. Only when I understand all 4 of these that I can really make an informed recommendation about whether a peptide is the right step for you. And sometimes it is, but sometimes the answer is we need to fix your sleep first, or your gut first, or your hormones first. Find where this inflammation started. Get to the root cause first. That's the better answer than just putting peptides on top without knowing what's going on underneath. So who, after all of that evaluation, ends up being a good candidate for peptide support? Generally, it's someone who's done the foundational work, or is actively doing it and has hit a wall. The person with the chronic pain or injury that just isn't healing, they've done the physical therapy, they've addressed the inflammation, the tissue is just not repairing. That's where the healing peptides like BPC157 and TB500 might be appropriate. We talked about that in week 2 with Sarah's story. The person on the GLP-1 who's losing muscle along with fat, they're eating adequate protein, they're training, and they're still losing lean mass. What about the growth hormone secretagogues like CJC 1295 and ipamorelin? They may help support body composition during that process. That was in week 3 when we talked about Diana's story. The person with the unexplained fatigue despite optimized labs, sleep is addressed, hormones are managed, thyroid is fine, they're still exhausted. Mitochondrial peptides like mots-c and SS31 are being discussed for exactly that situation in week 4. The person experiencing cognitive decline that conventional workups haven't explained, or brain fog, or memory issues, or focus problems. Neuropeptides like Cmax and C-Link are being studied for cognitive support and anxiety. I discussed this alongside with my Bredesen certification in week 5. The person whose recovery has plateaued, body composition is shifting despite everything that they're doing is right. Sleep isn't restorative even when it's optimized. Growth hormone support through CJC 1295 and ipamorelin stacks administered at bedtime to align with natural circadian growth hormone release may be appropriate. Notice the pattern? Every single one of these candidates has already addressed the foundations. The peptide isn't the first step, it's the next step. And just as important, who is not a candidate? Well, anyone with active cancer or a history of certain types of cancers, because growth hormone peptides stimulate that growth hormone pathway, and they are generally contraindicated in patients with active malignancies or pre-existing tumors. You must screen for cancer risk before starting any growth hormone support. This is non-negotiable. Anyone with uncontrolled diabetes, growth hormone can affect the insulin sensitivity. If blood sugar isn't well managed, these peptides can actually complicate the picture. Anyone who hasn't addressed the foundations, and I say this with care, not judgment, if you're just sleeping 4 hours a night, eating poorly, not moving your body, not dealing with chronic stress, or drinking too much, a peptide is not your answer right now. Your answer is this foundational work, and once that's in place, then you can revisit this. Anyone self-prescribing from the internet, I need to say this clearly, peptides purchased online without medical supervision are not regulated, not tested, and not safe. You don't even know what's in them. You don't know what the dosing really should be, and you don't have that monitoring. I have seen this in patients come to me with complications from self-prescribed peptides, and it's preventable because that stuff is scary. Don't let your first symptom be your last, and don't let the wrong provider or no provider at all be at your starting point. So what does this process actually look like in my practice? It starts with a comprehensive evaluation, not a 15-minute appointment where someone looks at one lab value and writes a prescription. A real evaluation. I look at hormones, not just the total levels, but the free levels and the ratios and how they all interact. I look at gut health, inflammation markers, metabolic function, nutrient status. I look at body composition through my InBody. I look at lifestyle, sleep, protein intake, diet, hydration, training, stress. I look at environmental exposures. And then, only then, do I determine whether a peptide is the right tool for that specific person at that specific time for that specific goal. Sometimes the answer is yes, and we build the protocol together. Sometimes the answer is, well, let's fix these 3 things first, and then let's readdress things in 90 days. Both of those are good answers. Both of those are me doing my job, and that's exactly what early detection longevity medicine looks like. It's not reactive. It's not a one-size-fits-all. It's looking at the full picture and in informed, personalized decisions. I want to take a step back for a moment because this series was never really about peptides. Peptides are tools. Peptides are powerful tools, promising tools, but they're tools. What this series was really about is a different way of thinking about your health. It's the belief that your body has incredible systems for healing, for energy, for cognition, for recovery, and that when those systems really struggle, the answer isn't always another medication or another appointment where someone tells you your labs are normal or gives you another pill for an ill. Sometimes the answer is actually looking deeper, looking earlier, looking at everything together instead of one piece at a time. That's what I do. That's what early detection longevity medicine means. And whether you ever use a single peptide or not, my hope is that this series gave you a new lens for understanding what your body might be telling you. If you watched this entire series, all 7 weeks, thank you. That means so much to me, and I don't take that time for granted. If you're just finding this video, the full series is linked in the description right here on the screen. Start with week 1 and work through the series. Each week builds on the last. If you want to find out where you stand, whether peptides might be right for you, what your body might be telling you, where the gaps are, take my free assessment. It's linked in the description. It takes a few minutes and it will give you a starting point. And if you want to work with someone who actually looks at the full picture, hormones, gut, lifestyle, environment, not just one number, not just one symptom, there's a link in the description for that too. Everything I do, every protocol, every patient, every video runs through my one belief. I'm Dr. Myra Reed, helping you to live smarter, stronger, longer. Don't let your first symptom be your last.